Well, hello, everybody, and welcome to our special presentation here of Biblical Finances, the Biblical Principles of Finances with Natalie Tilson. And Natalie, we are so excited that you're here today. And at this point in time of this recording, it is middle of October, and something is coming up, and it's that we're going to talk about, and it's not Halloween, it's not Thanksgiving, and it's not Christmas. What is it?
Exactly. Well, Scott, tonight we're going to talk about open season, open enrollment for Medicare plans.
Okay. All right. That's a little confusing. We're seeing a lot of commercials on TV and hearing a lot of stuff. What do we need to know about that to help us make good decisions?
Well, Scott, this is very confusing, especially for our senior population. I know every year at this time, my mom, who's coming up on 83 years old, she gets very nervous about this because it is very confusing. And something that comes to mind from our Bibles, from Deuteronomy 5:16, it says that we are to honor our father and our mother. And Scott, when we honor them, that of course means to respect and obey, but it also means to care for them. And this is a time where we can really put that into action and help them to navigate through this very difficult stuff for them to try to understand.
And it can be scary for them because they know at their age they need health care and they don't want to make any wrong decisions. But it seems like we're bombarded from all sorts of angles on this.
Right. So let's try to unpack this a little bit tonight. Maybe we can offer some people out there some guidance. And first of all, I want to stress that I'm not just talking to our elderly population here. I'm talking more to the ones who may be middle-aged, who have older parents or grandparents, possibly even a neighbor, aunt or uncle. Reach out to them. Make sure that you are helping them during this time. And I'm hoping that maybe I can educate a little bit about this, because we have a lot of acronyms that are floating around out there, almost like a alphabet soup or something at this time, isn't it? And that can be very misleading. And that's actually, I think, a tactic that gets used, because if we can confuse people, they're quick to say, okay, just whatever. Sign me up for anything.
Yeah. Which is very dangerous.
And we don't want that.
Yeah.
So what I want to explore tonight, I want to explain that there are basically two options that our seniors have here. One is traditional Medicare or original Medicare. And with that, you can think about, the federal government with Medicare, that type of plan. Second, and this is more what we're going to be talking about, is Medicare managed plans, or you may have heard them called managed Medicare. They both are the same, whether you call it a Medicare managed plan or a managed Medicare plan. And basically, to explain what this is, we have our insurance companies who want a piece of the pie, so to speak. Okay. We have our large insurance companies, for instance, United Healthcare, we have Humana, we have Cigna, we have so many others that are out there. And these are insurance companies who have gotten into the Medicare realm. Okay? So let's look first with the traditional or original Medicare. What do we have that's covered under traditional Medicare? Well, we have what is referred to as Part A, and that is just for inpatient coverage. And what I mean by that is basically a hospital stay or a post-acute hospital type of stay. So basically, if you're in a hospital bed, that's inpatient. Okay, Part B is outpatient coverage. So this would be like, for instance, doctor's visits, or maybe home health visits, or it also covers some durable medical equipment. And there's another acronym we run into from time to time, DME. Okay. People wondering what that is. And sometimes that could be like for instance, potty chairs or something like that that you're going to need at home after a discharge from a hospital, for instance. Now, with our Medicare managed plans or managed Medicare plans, same thing here, with our insurance companies, the large insurance companies, the familiar names like I spoke about a minute ago, I want to go over some pros and some cons with this.
Okay.
So first of all, anytime an insurance company takes on the Medicare portion, they have to, at a minimum, cover what traditional Medicare covers, which is Part A and Part B. Now here comes one of the tactics that will get used when a salesperson is trying to sign you up for a managed Medicare plan. They will say, oh, but you have traditional Medicare, which is true. That part is true. They have to offer you that at a minimum. However, now here's where we start getting the competition to come in with the additional benefits that can be offered. Okay. So let's say, for instance, that I work for United Healthcare and you work for Cigna, and we're trying to get people to sign up for our plans. Okay. Well, we both have to offer them Medicare Part A and B. Right. That's a requirement. But then now we're competing against each other. So I may say, well, you know what? I'm going to also pay for 2 dental cleanings per year, plus give you a pair of eyeglasses every year. Right. Well, you're going to say, oh, yeah, well, I'm going to do that, and I'm going to give you some hearing aids. Right. And so we start competing. That's where the plans all come in. Okay. And they vary, and the insurance companies will set their own prices as well. So there's competition there. Right. As well. Now, another thing that people see as a pro is that you do have low monthly premiums with your Medicare Advantage plans. So at this point, everyone out there is probably saying, well, that's a no-brainer. I'm going to go sign up for a Medicare managed plan. Right. Well, I want to discuss some of the cons as well, because I'm pretty sure that the people who maybe have their little fold-up table at Walmart right. that we see so often, and not to pick on Walmart, they're at other stores sure. as well, right. During this time, they may not go over all the cons that are out there. Mm-hmm. And I want everyone to be able to make a wise, educated decision right. because we are talking about our health here. That's right. Now, since we have low monthly premiums with Medicare managed policies, on the flip side of that, we have high maximum out-of-pocket costs. So that's something that we need to keep in mind as we're choosing, do we want to stay with a traditional Medicare plan or go with a managed Medicare plan?
Right, so it's important you know both of those things, and that's sort of the way it has been traditionally. I know even when I was younger, I would opt for a higher deductible to keep my premiums lower. Exactly. And that's okay if that's explained to you, but if it's not, that's right. really important.
And it really depends on the person and their individual situation with their health and their finances right. to make a decision here.
Yes, because if you don't have that money saved back that we've talked about,
right.
Having a $10,000 or $12,000 or even on up, that can really mess you up.
It can really affect you. Also, another con is that you have the facility and provider networks. They're very strict about their policies. Mm-hmm. When they set those policies, you don't have too much wiggle room there. And referrals are required when visiting a specialist. So that is really the point that I want to stress. Sometimes if you have like in the case of some of these plans, if you have a decision that is made by that managed Medicare plan that doesn't cover a test or a procedure or something that you feel that you really need health-wise, then that's going to be hard for you to win an appeal to get that coverage.
So you may have to pay that out of pocket.
You may be paying that out of pocket.
Your doctor is requiring that or whatever.
That could potentially be the case. Now, understand that under these managed Medicare plans, you have HMO plans, you have PPO plans, and you also have point of service plans, which are kind of a hybrid between a HMO plan, a health maintenance, or a PPO, a preferred provider. So it gets even more confusing if you decide to go the managed Medicare route to choose the one that is most appropriate for you. Now, with PPOs, the preferred providers, there are fewer restrictions than HMOs, but the premium rates are usually higher. They're going to get you one way or another here. So, you have to kind of weigh that out based on your individual needs. The HMOs do have limited appeal rights, which I just talked about. And because with that, you don't have a third-party unbiased opinion. When you appeal something, you are appealing it to another employee of that company.
And I think this is a really, really important part because, I've had some health issues and things, and if there's disputes over something, nobody's got your back.
Exactly. Exactly. So the chances of you getting that appeal won on your behalf are kind of slim. And point of service plans allow you to use out-of-network doctors, and you pay the in-network costs if your primary care refers you to an out-of-network provider, but you have to receive that referral. And they also require a prior authorization. Now, this can get very confusing, and it can also, I can tell you that from the time that I worked on the flip side of this and working for providers, this is a part that really got very frustrating, I would see, for a lot of families. Because we have to keep in mind that these insurance companies are for-profit, publicly traded. Let me say that again. Publicly traded companies. And not only are they trying to increase their revenue, they're trying to decrease their expenses.
Sure, because they're a business.
They are a business. They want to produce great quarterly earnings. They want people to purchase their stock. They're in competition with all the other publicly traded companies that are out there that may or may not even be in the healthcare business. So you really want to take things like this under consideration whenever you're looking at determining what is best for your health or for those loved ones in your life who are going through trying to make this type of decision. Now, let me make just a few suggestions, if I can, about all of this. I would say, first of all, you always want to be aware of marketing techniques. Really, when you step into Walmart to buy your groceries and you have a salesperson sitting there saying, "Hey, have you signed up for your Medicare plan?
You've only got a short time left."
Right. Come over and let me help you decide what's best. Do you really want a salesperson who's probably receiving a commission, let's just be honest, for how many people they can sign up, to be the one to decide the care that your mom, your grandmother, or someone special to you is going to be receiving for the next year?
And that could be lack of care.
Lack of care. That is very scary. I can tell you that what I experienced working in post-acute care was that these managed care plans, when the beds really got backed up in the acute care hospitals and they were looking to push them on out to a post-acute care, Medicare patients we could take immediately. we could receive them straight from the emergency room if they did not need to stay in the hospital for a few days to become stable. A lesser level of care, they didn't have to have a pre-authorization from the managed Medicares, but let me say that, a lesser level of care. Yeah. Less money on the part of the insurance. So guess where a lot of those people would end up going? To the lesser level of care. Yeah. Because the cold hard fact of this, they just happen to be in the business of health care. But it is still a for-profit, publicly traded business here. And we dealt with this on a day-to-day basis, seeing people who really needed to be at a more aggressive level of care, but because it was a higher cost to the insurance, they would not receive that. And one of the games that they would play is that they could take up to a total of 3 days to get an answer back to you, to that family, you know, on whether or not it would be approved to come to where I worked as a post-acute provider.
Right. And those could be life-saving measures that
where
have
people
to be postponed.
could
that's right.
really be able to, you know, begin their therapy, whatever, get back home, that type of thing. And, you know, with those 3 days, that was kind of a tactic that was used as well, because in the meantime, you've got the bed crunch in the acute care. Case managers are getting the pressure of get them out the door. We've got a bed, somebody that will take them, get them gone. Right. And a lot of times families would not get what the placement that they really wanted for their loved one, simply because they were having to wait for 3 days to get a pre-authorization. Right. So these are things to keep in mind, and I'm sure that we've all heard various scenarios with people who have tried to get certain procedures covered or things like that, and they have to get on the phone, maybe have an appeal or whatever, in order to just get coverage for a certain test or procedure.
Right. Have you got any good news in this arena? Because it's very, very hard.
It's very hard.
And,
and you
no
can
matter
see,
what your age is.
Right, and you can see how very confusing this is for an elderly person. So I would say be aware of all these Medicare managed marketing techniques. If the concern is expenses, no, like deductibles, co-pays, co-insurances, things along those lines, a lot of people don't know that there's something out there called a Medigap plan. And this is something that I would really encourage you to look into, because there's a lot of dollars that I think are sort of left on the table out there for people maybe who are having trouble paying these expenses, and they would qualify under a Medigap plan. Right. Also, what a lot of people do not understand is that CMS is the Centers for Medicare and Medicaid Services. Why it's not called CMS, I have no idea. But with that, I would encourage people, if you're having financial issues, maybe see if you qualify for Medicaid as well, that some of these costs could be covered. Now for drug costs, because a lot of people choose the managed Medicare route for the Part D under that for their drug costs, I would say, you know, maybe shop around with some pharmacies and ask about their in-house pricing on certain medications and check on some discounts there.
It takes a little bit of time.
It does.
But I'm on a medication now that was going to be very, very expensive, and I said, listen, I can't afford this, we can't do it. And then they brought it down to unbelievably low price.
Exactly.
And so I'm able to take that, but if I'd never called and pursued that, then I would have.
You would have been paying the higher price.
Or not taking it.
Exactly.
And my health suffering for that or whatever.
Exactly. Also, another thing that a suggestion is, we've talked about sinking funds, I know, in the class that we just did. So, you know, possibly look at setting up a medical sinking fund to cover your deductible, co-pays, dental cleanings, glasses, things like that, if you choose to go the option of the traditional Medicare, where you don't have to worry about all this pre-authorization
And you've
and
got
things
control
like that.
over it instead of having
You've got
to
control
have it
over it.
pre-authorized and all that stuff. You've got the money set aside in your sinking fund, and that's a
Right.
great idea.
And just to give people an idea, for 2023, the Medicare deductible is going to be $1,600. You know these things up front. You can start setting aside money each month. Hopefully you won't need to use that. If you don't, you know, you've got money there for the next year, but go ahead and start saving for these things. And finally, just educate yourself and determine what is best for your particular needs. I'm not saying, you know, some people may say, well, Natalie, after I've looked at this, these very high-cost drugs, it's going to be a managed care plan that I need with the Part D. Well, that's fine, but understand, like we talked about a second ago, within there you've got the HMOs, the PPOs. You've got to be able to know what you're looking at and what's going to work best for you. So, Scott, I can tell you that for my mother, like I said, she's coming up on 83 years old. The advice that I have given her, even though, you know, I'm constantly trying to talk about ways to save money and everything, obviously, with our biblical principles of finance, when it comes to your health, I would say that there's better ways to explore money savings than to gamble with your health. And I have always told my mom for many years, never give up your traditional Medicare, because in the event that, heaven forbid, if something should happen with her, I want to know that I'm not, when I'm distraught as a daughter, having to argue with an insurance over the phone where I want my mom to go, what procedures I want her to have, or tests or whatever, and trying to get approval against an insurance company that's really looking out for their bottom line. I don't want to have to deal with all that.
Yeah.
Now, fortunately, my mom's a very savvy lady, and, you know, she makes sure that she's got the money set aside to cover her glasses and dental and things like that. And that's more of the route that I can say that I have chosen for my mom, and it has worked well for several years. But, of course, everyone has to decide what is best. But I would encourage you, do your homework and make the best informed decision. Now, as I did say a minute ago, open enrollment began October the 15th and will continue through December the 7th. And the coverage, based on whatever plan you decide to go with, will go into effect January 1st of next year. So right now's the time to really be looking into things. Don't save it for the last minute when you feel that deadline coming up on you. And I do have some information for people here. If you want to compare the plans, you can go to Medicare.gov, or you can call 1-800-MEDICARE. If you do not have access to a computer. Or you can also check out CMS, that's Center for Medicare and Medicaid Services, CMS.gov, and they have some really good frequently asked questions that are out there with answers to them.
That's great. So let me go over that again. You correct me if I'm wrong, but Medicare.gov, 1-800-MEDICARE, and CMS.gov are some of the resources that you can go to. And these are names that, it's a trusted site. You don't have to worry about all this. And Natalie, it seems to me like in the advertising and everything, we just need to watch when people are dangling carrots or, showing a lot of bells and whistles, when these are things that we could afford a lot cheaper and have more control. And man, great information. Thank you so much for this. I appreciate you coming and sharing today. Anything else?
I believe that's all the information I have for this, Scott.
That's great. That's great. Well, we're praying for you, and God will help guide you. And it's amazing when you have to call and talk to people sometimes about your health care. It's very, very hard. There's a lot of pressure all the way around, but I pray that you'd find a Christian on the other end that's got a heart for God and will answer your questions and get back to you in a timely fashion. But again, thanks to Natalie Tilson here today for Biblical Principles of Finance. We hope this has been helpful, and I hope you have a great day.